Imagine dying from a simple cut on your finger, or a bad case of diarrhea or food poisoning, or watching your child suffer from a respiratory infection, knowing that there's a high likelihood that the medicines that he or she will be given won't work. When antimicrobials such as antibiotics and antifungals are misused or overused, the pathogens targeted become resistant and existing treatments are no longer effective. And then you have a situation called antimicrobial resistance, or AMR, as we know it. This is now a global threat because already 1 in 6 bacterial infections are resistant to antibiotics, according to numbers from the World Health Organization. If the world does not act decisively, routine infections that we normally take for granted could become life-threatening. And the key to stopping the growth of AMR is diagnostics, plain and simple. You cannot treat if you cannot test. Yet today, the reality for 1 in 2 persons worldwide is that they cannot access the tests that they need. And in the absence of accurate diagnostics, healthcare professionals are forced to treat symptoms, often with broad-spectrum antibiotics. While this may sometimes work, there is the risk that the patient will not be cured, which then means prolonged suffering and in a minority of cases, death. But this also contributes to the AMR challenge that we currently have. It was Alan Merrill who said, without diagnostics, medicine is blind. Therefore, we must do everything in our power to ensure that accurate, reliable, and affordable diagnostics are available to all those who need them and at every level of healthcare. Diagnostics guide appropriate treatment. They help preserve the antibiotics we currently have, and they are essential for protecting public health. Protecting the tools, that is these antimicrobials, starts with us having accurate and accessible diagnostics. For more than 20 years, FIND has been driving innovation, building the bridge between industry stakeholders and policymakers to ensure access to diagnosis for all. If we act now, we can protect our present and secure the future.